Dr. Touma and Dr. Barraclough. So thank you so much for joining us. We will begin. So just before we begin, I just want to let everyone know that tonight's webinar is being recorded. So just so you know, it is a privacy concern for some. So please note our webinar is being recorded. Tonight I have with me who will be assisting me tonight. We have Jeremy, of course, who does our recording and is an integral part of this webinar that we do every month. He's also gets this on our website efficiently always, because I know sometimes there's so much in these webinars, we like to review it afterwards. I would also like to welcome Rupinder, Joy, and Sarah, who's part of the Lupus Support and Education Committee, and they will be sharing the spotlight with me as we begin. So tonight, like I said, we have our special guest, Dr. Touma and Dr. Barraclough from the Toronto Lupus Clinic at Toronto Western Hospital. We would like to thank all those who participated in the 2021 Virtual Walk for Lupus this year. We surpassed our goal of 75,000, but please note there's still time to donate until the end of September. Please take a note, our next webinar will be October the 19th, and it will be titled Fighting Fatigue Using Energy Management. And we have a special occupational therapist who will be doing that, Abigail Koch. For additional support outside of our monthly webinars, please be reminded, we have our monthly support group meetings, and you could contact Lupus Ontario .support to get those times and those dates for the support group meetings. For additional support outside of our meetings, we do also have an email available. You can email us if you need additional support at Lupus Ontario. Sorry about that, support@lupusontario.org. We're also available on Lupus on Twitter, Facebook, Instagram, and of course, we now have our new podcast, the Lupus Ontario podcast, that you can listen to anytime at your convenience. So without further ado, I would like to invite our President, Linda Keel, to give a special welcome to our guests and our members at large and the lupus community. Linda?
Thanks, Sandra, and good evening, everybody. It's wonderful to see so many people joining us this evening, and I know you'll enjoy this presentation. I'd like to thank Sandra and her team. They've done an amazing job putting on a great webinar program all year. And, you know, the interest is very high, and I hope you're all finding them useful. Just a reminder that Lupus Ontario has a long history of supporting lupus research. Over the years, we were instrumental in starting the Lupus Data Bank at Toronto Western Hospital. And also we have our Jeff Carr Research Fellowship. And Dr. Touma actually was awarded the fellowship twice. So it's wonderful to have him here presenting tonight, and along with Dr. Barraclough. And this topic affects so many of us. I think we all have some sort of days where things aren't working too well, and we're all really excited to hear the latest developments. I know, Dr. Touma, you've been working on this for a few years now, and this is just fabulous that you're taking the time to give us an update on where you are. So everybody came to hear Dr. Touma, not me. So I'm going to turn it over to our presenters to present on lupus and the brain, which is a great topic of interest. So thank you, everybody, and enjoy the webinar.
Okay, thank you, Linda. At this time, I would like to ask Rupinder Sandhu. She will be introducing our very special guest tonight, Dr. Touma. Rupinder, can you please do the introduction?
Sure, thank you, Sandra. It's my great privilege and honor to introduce Dr. Zahi Touma, who is an associate professor of medicine and clinician-scientist with the University of Toronto and scientist with the Krembil Research Institute and Schroeder Arthritis Institute. Many of you may know him as a staff rheumatologist with the University Health Network and Mount Sinai Hospital. His research, as you heard, is focused on patients with systemic lupus erythematosus and measurement science. with a particular interest in the assessment of disease activity. Dr. Touma is a member of the American College of Rheumatology and sits on various committees and subcommittees. As you heard, a major focus of his research is in the assessment of cognitive impairment in patients with SLE. Dr. Touma has established the NeuroLupus program, which consists of a team of experts in psychometrics, neuropsychology, neurology, psychiatry, measurement, and bioinformatics, with the goal of developing improved methods of identifying cognitive impairment in SLE and understanding its course over time and the impact on health-related quality of life and productivity. Dr. Touma has been recognized by various organizations and his peers. He's received a variety of grants from large and small organizations, including Lupus Ontario, as Linda said. And in February of 2021, we congratulate Dr. Touma, who is the recipient of the Canadian Rheumatology Association Emerging Investigator Award. As well, he's been the recipient of an Early Researcher Award from the province of Ontario, and that was more recently. So congratulations to Dr. Touma, and I will hand it back to you, Sandra.
Okay, thank you, Rupinda. Thank you for doing that. I know you have a special relationship with Dr. Touma, so I do appreciate you taking the time for the introduction. I will now ask Joy Phillips to introduce Dr. Michelle Barraclough. Thank you, Joy.
No problem. So I'm delighted to introduce Dr. Michelle Barraclough. Dr. Barraclough received a PhD in neurocognitive function in SLE from the University of Manchester, UK in 2016. For almost 10 years, she has been working in Manchester, UK on projects investigating cognitive dysfunction in SLE, specifically using functional MRI and computerized cognitive batteries. Dr. Barraclough joined Dr. Zahi Touma's team at the Toronto Lupus program to continue her work in this field with the hope of furthering our knowledge in this debilitating condition. So welcome.
Thank you so much, Joy. And for those of you who don't know me, I should have done this at the beginning. My name is Sandra Williams-Reid, and I am the Support and Education Chair for Lupus Ontario. It gives me great pleasure in introducing Dr. Touma. Thank you, Dr. Touma. You may begin.
Well, thank you. First of all, great to see you all here, and I do recognize a lot of faces. Thank you for the long introduction. But as Linda and Sandra and others said, really the start was with Lupus Ontario, with the Jeff Carr in 2008, and I think again in 2009, if I remember well. So there is always a start for something. And I'm very happy today here to present on this topic. And it's a privilege as well to have with us Dr. Michelle Barraclough. So without further ado, let's start the topic. So just to refresh the memory about systemic lupus, if we have people here watching us as well. As you know, systemic lupus is an autoimmune disease that can affect multiple organs. The course of the disease can waxes and wanes over time, and it's characterized by disease activity and irreversible change damage over time. And as you can see here illustrated, lupus can affect every organ. The focus today is on the brain and particularly cognitive function, but we know that it can involve the heart, giving us something called pericarditis or chest pain. It can cause as well inflammation in the muscles of the heart. We call it myocarditis. It can affect the skin, causing different type of skin rashes as well. It can affect the intestine, the gut, the joints, and other organs as well. Next slide, please. Thank you. So let's bring it back to the topic of today, which is involvement of the brain. So the American College of Rheumatology has defined many years ago 19 manifestations, or we call it as well syndromes. And as you can see here, among this long list, we circulated today's topic, which is cognitive impairment or cognitive dysfunction, which means simply when there is alteration in one of the cognitive function. And I know Dr. Michelle will be talking more about this very soon. But also, as you can see here in the list, we've got other manifestations as well. Stroke can be related to lupus activity. Mood disorders such as anxiety, depression, headache, and we see as well psychosis in lupus patient. Also peripheral nervous involvement, not just only the brain, and that can manifest as peripheral neuropathy and other manifestation. But again, the focus today only is on cognitive impairment. And as you can see here, if we just take the prevalence, which means if we look among lupus patients, how common do we see neuropsychiatric lupus? So everything related to the brain and the nervous system, we call it as NPSLE or neuropsychiatric lupus. And you can see this can go up to 75, really high prevalence. And cognitive impairment is one actually of the common manifestation of neuropsychiatric lupus. Next slide, please, Michelle.
So there are many different types of cognitive cognition. So this slide gives you a rundown of those. We've got attention, so being able to concentrate and things like that, and how quickly you can process things in your brain. We have manual motor speed and dexterity. So this is something like, for example, how quickly you can do the buttons up on your shirt and things like that. Then there's this term called executive functioning, which covers a whole host of different cognitions. So things like planning, so your daily planning, how you do tasks, how you manage your time, organisation and self-control. There's learning and memory, which I think most people will understand that and probably have the feelings of problems with this from their lupus. We have verbal fluency, so this is being able to recall words quickly, and then visual spatial construction, so about being able to see all the parts of an image and being able to reconstruct it. So we've got many different things that fall under this term cognition, so people can be affected in many different ways. And the ACR, so the American College of Rheumatology, they defined cognitive impairment in lupus as having problems in one or more of these main cognitive functions. When we think about the causes of cognitive impairment in lupus, there are many causes, unfortunately, and some of those are specific to lupus and others not, and can be more associated with chronic disease in general. So this diagram gives us a quick representation of some of those potential causes. So we have depression is linked with cognitive impairment, certain medications, fatigue, pain, brain changes and brain abnormalities, which is seen in lupus, and then autoantibodies and inflammation, as well as disease activity itself. I'll hand back to Dr. Touma to tell you about what's going on in the clinic at the moment. You're muted, I think.
Thank you, Michelle. And just to summarize what we've heard from Michelle is that really it's something very common. And almost every third or even every fourth patient coming to the clinic share with us some of the cognitive challenges that they can have throughout the day, which often can be short memory, and it could be sometimes multitasking when you are doing a more required kind of task that needs multiple part of the domain function cognition to be involved. And as you can see here, this is a reflection of what currently we are doing in the clinic. And always you need to start with measuring things. And in this slide here, we reflect on the bottom part, some of the tasks that we do to measure cognitive function. So it's very standardized, and there are different ways to do it. The American College of Rheumatology has recommended a battery, and that battery can go up to an hour or even a little bit longer. But we know in clinical practice, we need something which is applicable for the physician and the patient. Probably the patient has no time to spend for an hour, or even with a very busy schedule clinic, it might be very challenging to spend an hour doing this assessment. And in addition to the time, there is as well cost associated with this test. And we know that it's not covered by OHIP and other insurance companies. This is why it's very important to make a change in the field and see what can we use as a screening test. Always things start with a screening. And if we find that there is a signal, we move to a more diagnostic, probably longer test. So what we've been doing in the clinic here, trying to identify good tests that can help us to screen for cognitive issues among the patient that we're seeing in time, keeping in mind the cost and the time burden for both the patient and the healthcare team. So this is where we are right now. We're assessing different tests. At the same time, you've heard that cognition, multiple factors can affect cognition, including disease activity and inflammation from the lupus itself. This is why it's very important as well to be able to measure certain biomarkers such as cytokines and antibodies and see how can this link to the cognitive function. Does it make it worse? Is it changing over time? And really, so far in the field, it's very new what our team and our other people are doing to try to identify biomarkers that can help us to see the association with cognitive function and how this is changing over time. At the same time, so you have seen two modalities here: test, biomarkers, blood samples, and something very important as well, imaging. And this is the focus of Dr. Barraclough on this. So up until now, the current images that we have for brain are not able to see the problem that we have related to cognitive function. So the current images that we have are more to focus on what we call the structure of the brain, if there is stroke or other bleeding in the brain. But the tiny, let's say, changes that can be related to cognition, the current modalities that we have available for every patient cannot assess for this. But there are new promising modalities, which I will let Dr. Barraclough later on talk about it.
So we just wanted to tell you a little about what research we've been doing so far and what results we've been finding. So we know that cognitive impairment in lupus is quite prevalent. Some recent work by our team has found that 38% of lupus patients have been shown to have cognitive impairment. And this 38% refers to what we call objective measurable cognitive impairment. So this is when people have been sat down and done actual cognitive testing with us, and might be a little bit different to this idea of brain fog, which we're going to talk about a little bit later on. So it may be that we're actually seeing this idea of brain fog is even higher than the 38%, but this is specifically referring to those people who are scoring in the impaired range when having tests in the clinic. We also know that it's almost 3 times more common than in lupus patients and in the general population, and almost 2 times more common than with people with rheumatoid arthritis. So thinking back to all those potential causes that may affect cognitive function, we knew that there was quite a few that were not specific to lupus, but clearly looking at this, there is something that is very specific about lupus that is causing these problems as well. And it's one of the things we are trying to do, and I'll talk about this a bit further on, is trying to try and understand in the individual what these potential causes might be. Now, Dr. Touma has mentioned about measurements and measurements of cognitive impairment in lupus and how important this is and how we need to be able to measure this better, more efficiently, so it reduces the time burden on patients as well as the cost implications. So currently, the standard set by the American College of Rheumatology is a fairly long battery of tests. And if you look at the literature, most people who are when they're doing research looking at cognitive impairment are not using this battery as it was suggested, but might be tweaking it a little bit or changing things. So there needs to be a more standardized, easier test that can be used. We're seeing that screening tests are being used, which are useful, but they're not as informative as the longer battery from the American College of Rheumatology. And we're also seeing more drive towards using computerized tests. And this is useful on several counts. They're easier to use, but also, unfortunately, in the era of COVID that we are currently, we can do computerized tests remotely. So it cuts down on travel time, as well as making it much more convenient for those involved in the studies. So I did just sort of touch on this briefly about, so the gold standard, the test that we want is suggested to be used at the moment is the ACR battery. This is the traditional test of cognitive function. It has 11 different tests. It requires a trained psychometrist to do it. It takes about an hour, but then on top of that, you've got 30 minutes to do the scoring, and it can be quite expensive. As opposed to a computerized version, such as the ANAM, which is being used now more and more in lupus. This is 15 tests, but it's a shorter test. It's 45 minutes. It does its automatic scoring, and it can be done. It can be done in a more remote setting. So I will pass back to Dr. Touma to talk about cognitive impairment over time.
And I want to assure you that I'm keeping my eye on the chat, and I see very important question. We've left a lot of time to have a long discussion. And if I want to as well echo on what Dr. Barraclough has mentioned, as you've heard, we've been testing a computerized test, and so far the results have been assuring, because we have shown that this computerized test can be very helpful to screen for cognitive impairment among patients with lupus. And hopefully this, as I said earlier, will facilitate the screening, because it comes with a lower cost and time exposure burden. So in this study, which again, multiple people have been working with us, and this study was actually done by Dr. Taya Schiffman before she left us. She studied cognitive impairment over time. So what we have done in the study, we saw the patient initially at baseline, and we followed at 6 months and 12 months to see how things are changing over time. And what we found initially at baseline, 56% of the patient had some level of cognitive impairment. And if you look at this circle here at this image, 44% did not have cognitive impairment. And the assuring part that over the study period, they continued to be okay in terms of no alteration in the cognitive function. But we found as well that there is a group of patients, which is almost 14%, who did have cognitive impairment present at every visit at 0, 6, and 12 months. And there is a very unique group here, which is almost as well half of the population, 42% of this in this study particularly, I mean, who did have fluctuation. What does it mean? It means their cognitive function could be impaired, then it goes back to normal. And again, there is some alteration and goes back to normal. And if you ask me, did you look more to see what's happening here? Yes, we did. And we found actually the dark blue color here, patients who always were cognitively impaired, are the patients who did have more severe impairment as opposed to other patients. So those who were at the borderline, let's say, or mild cognitive, they kept fluctuating between normal level to abnormal, normal to abnormal, as opposed to this group who was always on the low side of cognitive function. Now, as we mentioned earlier, really cognition is multifactorial. What does it mean? It means there are multiple factors around us that can affect cognitive function. You've heard about mood disorders such as depression, anxiety, sleep, disease activity. All these factors can alter cognitive function. But at the same time, we found that there are factors that can help to maintain a good cognitive function over time. Some of it, such as higher education and other factors as well.
So this is the work that Dr. Touma has mentioned that I've been working on. So it was studies that I've been doing in Manchester, and there's other teams out there as well who are doing the brain imaging studies in lupus. And one of the reasons why I've joined Dr. Touma's team is to continue this work. So you heard Dr. Touma earlier mention that when we look at clinical brain scans of people with lupus, we do find some differences to healthy volunteers. However, these differences are rarely associated with cognitive impairment. So we're not managing to pick up what's going on as well. So it meant that research moved towards a different way of measuring things, and it used this technique called functional magnetic resonance imaging, or fMRI. So fMRI is a way of looking at how the brain is working, and in this case, how the brain is working whilst people are doing cognitive tasks in the scanner. So tasks to test your memory, tasks to test your attention, and we can look at which bits of the brain are active and are they more or are they less, and we can compare to healthy volunteers as well. And it gives us a good measure. And the studies so far, what they're seeming to find is that quite a number of lupus patients, thankfully, are performing really well on the cognitive tasks that we give them in the scanner, so very similar to the healthy volunteers. But in order to perform at that level, their brains are having to work that bit harder. They're enlisting extra regions of the brain to get involved, as well as having greater levels of response in certain areas. And so this might be why we're getting this move towards brain fog. So I think this is where we might be able to see the differences between cognitive impairment and brain fog. So I think they're all very, very much linked. So as I mentioned earlier, we have this objective measure that we can do for cognitive impairment. We can see, we can give you tests and we can see whether you are considered impaired on the spectrum of this test. And we see that some people who come in and have mentioned this idea of brain fog and feeling just cannot quite work the same way as they used to do. And they might actually perform very well on the task, but clearly there's something there that is not working as they would want it to and how it used to work. And we think this is because your brain is working harder because of these changes that are happening in the brain. And we think this is probably cognitive fatigue. So we think that the brain fog may be more likely to be cognitive fatigue as opposed to cognitive impairment, and that they're all very much linked, and that one may lead or cause and lead on to the other. And that's where we're going with our research at the moment. And I'll hand back to Dr. Touma for this slide.
I keep my eye off the chart. Really such an important question, and we're going to answer them all. I'm happy to see you're asking about MoCA and MMSE and other tests on cognition. Thank you. And I wanted to say something here very important as well before getting to this figure. We all know that lupus, it's a disease of 1,000 faces. And every time you see a lupus patient in the clinic, you need to know which lupus I'm dealing with. Is this the lupus with the skin rash? Is this the lupus with the kidney involvement or the joint? And let me tell you, with cognition, it's also, I don't want to say challenging, but it takes time to untangle the etiology there and understand, as you've heard, which type of cognitive impairment we're dealing with. As Dr. Barraclough has said, it's very important to delineate, is it the brain fog or the cognitive impairment that probably related to lupus activity that we can reverse with medication? Or is it something related to damage that could have happened in the brain because of ongoing inflammation, where we can't reverse things backward, but we want to maintain where we are? So I like this image because it reflects what we do again in the clinic when we see the patient. You see on the top of the iceberg, we as physicians spend a lot of time on disease activity. What does it mean? We measure, we examine the joint, the skin rash, look at the blood test and the proteinuria, and damage, which things irreversible that can happen from lupus, osteoporosis because of the prednisone, avascular necrosis, and I know you're familiar with these terms, scars because of the skin rash. But at the same time, we don't want to forget what's below the tip of the iceberg. And as you can see here, this can be captured by what we call patient-reported outcome. And it's very important to highlight on this. So cognitive function is among these as well. And you have heard from us that we're using some tests to measure cognitive function. But at the same time, you can also use patient-reported outcome to hear what the patient tells you about their cognition. Both are important, and you need to compare and make a judgment how to move forward.
So just to summarize what we've been through so far this evening, we know that cognitive impairment in lupus has a high prevalence. And currently, research and clinicians, there's not just one tool being used, and that the use of computerized tasks might be useful because it's easier, it's quicker, and more cost effective. We have seen that there is a specific pattern of how cognitive impairment develops over time in patients with lupus. And as we've said many times, there are many, many different factors, unfortunately, that can affect cognitive impairment in lupus. And it's very likely that it's different and depends on each individual patient. And we've also mentioned that not everyone has the obvious overt cognitive impairment, but may experience this feeling of brain fog, which we believe could be cognitive fatigue. So we need to look at this more. So areas that still need more research, we need to come up with a uniform measure of cognitive impairment and fatigue, cognitive impairment and fatigue. We need to fully understand how cognitive impairment is experienced over time, so we can track it and see what the trajectories are and when we can intervene and find useful, helpful treatments. We need to work with lupus patients to better understand the differences potentially between impairment and fatigue. And we need to find new ways to group patients based on the potential causes of cognitive impairment, because this will help us to personalise treatment in the future based on these patient profiles. So at the moment, there is within our team, there is ongoing work, and there's much more going on outside of our team as well. But within our team at the moment, we're looking at new methods to better understand cognitive impairment and cognitive fatigue in lupus. We're using sophisticated AI statistical models to try and look at phenotyping, so grouping patients based on factors that can affect cognitive impairment as well as their cognitive impairment and their fatigue. We're using fMRI, so looking at how the brain is working whilst doing cognitive tasks and seeing what the differences are and where that's occurring. We're hoping to use a new, well, it's not new, but a method, eye tracking measures. This is believed to be an objective way of measuring cognitive fatigue. So it's a very difficult thing to measure as cognitive fatigue as an objective measure. Obviously, listening to the patient tell us, and the subjective measure is incredibly important, but we also need some objective measures as well as the subjective. We've mentioned that we're using computerized assessments, and this is really helpful. Again, as I said, in the unfortunate times of COVID, it makes it easier to do remote studies, and it's probably something that we will continue to use in the future as well. And there is plans, there is a group being set up so that an international consensus on the measures used for cognitive impairment can be made. So we're also needing to understand what makes someone susceptible to cognitive impairment in lupus, and so we can then look at the long-term outcome as well of how this will affect people. And then probably the most important to everybody is the ultimate goal is to be exploring new treatment options and finding a way of making quality of life better and reducing this impact on patients. So was there anything you wanted to say, Dr. Touma, sorry? No. So when we think about treatment at the moment, the current treatment options tend to be coping strategies. So these are techniques suggested by psychologists and occupational therapists, things to help with sleep hygiene, as well as diaries and memory aids and things like that. Also, importantly, is to look for other potential causes of cognitive impairment. So physicians will look to treat potential underlying conditions, such as depression, or if there's something to do with the medication that needs addressing or looking at. And then I will hand over to Dr. Touma for ongoing research at the moment.
So as you've heard here, just if we want to summarize things, we showed you what we're doing at the level of measuring. And this is very important because you will learn about something if you're able to measure it. And in clinical trials, when we try to develop new medication, you need to be able to measure the things that you're referring to. This is why measurement are very important. And at this level, we have showed that one of the computerized tests really can be very helpful to screen for cognitive impairment. And hopefully very soon we will be able to download an app. So when the patient comes to the clinic, they will be in front of the computer or the iPad completing some of the tests. And while waiting for the physician, the information that they have applied, it will be uploaded through an app. And this app will give us a prelim analysis, if we want to call it screening for the cognitive function. So this is definitely gonna facilitate future research and to help us to move this field forward. And by the new ad with Dr. Barraclough that we have here, hopefully putting the measurement and the image together, our team and other people will be able to achieve more positive outcome to improve cognitive impairment. Now, at the same time, you've heard about different modalities of treatment that Dr. Barraclough referred to, such as cognitive rehabilitation, optimizing the task that we have to do, which means, in simple word, probably perform the tasks that are more cognitively requiring tasks in the morning, early in the day, when we feel refreshed, and keep probably the more easy task toward the end of the day. We all use probably smartphones, or we write to remember things. And again, this is that type of thing that can be also implemented to facilitate our functioning throughout the day. Now, you might ask me, what about medication? At this level, we have no specific medication for cognitive impairment in patients with lupus particularly. But there is actually currently an ongoing trial, and this is very important, very new in the lupus field, an ongoing trial investigating new medication for cognitive function in lupus. So there is no doubt that the future hopefully will be bright, and a lot of people are working on this, and we should start seeing some positive result hopefully down the road.